Good evening, doctors, and good evening, online viewers. Firstly, I am thankful for all those who are giving their precious time for my lecture for SLE. SLE full form is systemic lupus erythematosus. Today we are going to discuss about the theory first, and then we are going to solve some question those who are already asked in previous year. Okay, so firstly we are going to start with definition. Here it is definition of SLE. It is a chronic inflammatory systemic disorder or disease of connective tissues, CNT, connective tissues. So my dear friends, it's a multisystemic autoimmune disease. If you think about what are the causes are idiopathic. Idiopathic means nobody knows what was the cause, but in some cases their genetics also include genetics, my dear friend, genetics. So firstly I am going to teach the symptoms also here are the symptoms of SLE. So we are going to start from top till bottom. I already why I took a picture of a lady, because SLE is a most common in females as compared to male. 9:1 ratio according to the Harrison, a new guidelines. 9:1 ratio, 9 female affected, then 1 male is affected. So CNS we think CNS confusion in SLE, epilepsy, confusion, seizures due to SLE. If we think about the brain, okay, and on here's alopecia for patients, my dear friend. For a mouth there is oral apathous ulcer. I hope you see this. In skin we saw malar rash, or other name is butterfly rash. I will show you how it looks like. From nose also involved, and these like this, malar rash. Have you ever seen such kind of a lady? Like a butterfly rash, nose involvement and cheeks involvement. It's a butterfly shape. That's why malar rash. One more finding, discoid rash also sometimes. Discoid rash. And photosensitivity. Why? In SLE, a female when going to exposure towards the sunlight, she's going to be worsened. The rash is going to be more worsened. Okay, my dear friends. The next one is, we are coming back, coming towards lower side of the body. Upper side I already explained. Heart, it can cause anything: pericarditis, endocarditis, myocarditis mostly. But if we see the most common presentation on the heart, it's pericarditis, my dear friends. Pericarditis is the most common presentation in a heart with SLE. Okay, then lungs it causes the pleuritis, 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 my dear friends. Then musculoskeletal, like joints. It causes myalgias, arthritis, arthralgias. What do you mean by arthralgia? A pain, joint pain. Arthritis, it's an infection Okay, pleuritis, and then renal, it causes damage of kidney, glomerulonephritis, diffuse proliferative glomerulonephritis, diffuse. So, my dear friends, here the trade also include trade, classical trade in SLE, arthritis, fever, photosensitivity, discoid and malar rash is the classical trade in SLE. I written how to remember the symptoms. How we are going to remember the symptoms? Symptoms, so brain empty. Okay, so brain empty, sign and symptoms. As for scleritis, serositis, oral ulcer, I already written on mouth. Arthritis or musculoskeletal. P, photosensitivity, my dear friends. Brain, B. B for blood abnormalities, blood normocytic normochromic anemia of chronic disease. R, here R represents the renal pathology like glomerulonephritis and renal damage. A represent here A and A's, anti-nuclear antibodies. I for immunoglobulin, my dear friends. Immunoglobulin markers like dsDNA, like anti-Smith antibodies. And for neurotic symptom, neurological, which I already written here, confusion, epilepsy, seizures. M for malar rash, the butterfly rash. And D for discoid rash, my dear friends. So, if we, okay, I'm going to wrap this one. I hope you understand till here. No problem. Okay. Then we are going to know about the investigation, signs and symptoms. Okay. So, sign and symptoms. We already discussed about signs and symptoms, but now initially investigations. We need to go for ANAs, antibody, AB, anti-nuclear antibody is the most common initial test. If this one is positive, anti-nuclear antibodies, this is specific for SLE, then we go for highly antibodies that confirm the diagnosis like dsDNA antibodies. Another one is anti-Smith antibodies. This is the most specific one. Okay. Then treatment depends on the cause, but here because we don't know the causes, we don't know. Idiopathic, sometimes drug induced also, but I am going to talk about later on. Okay. Now treatment. We give methotrexate also sometime, cyclophosphamide, azathioprine, prednisolone, methylprednisolone, depends on a condition, how severely a patient is affected, and if there is a pain, we can manage by NSAIDs, my dear friends. So now I am going to tell you about drug-induced lupus erythematosus, drug-induced. So how we are going to remember? I written here a trick ship, SHIP ship. Okay, so remember it. Ship sulfonamide drug, H-hydrolazine, that is used in pregnancy to treat a pregnancy-induced hypertension. I represent isoniazid. Isoniazid we are going to use in tuberculosis, procainamide. These are the drugs. If patient have a history of taking such a drug, and if we see SLE symptoms, then what was the treatment? Treatment to stop these drugs immediately. And how we are going to confirm? We can do an antibody here. We can see antibody, antihistone antibodies. So, my dear friends, I hope you understand till here. Now we are going to talk about pregnancy with SLE. So I'm going to wrap this one. Okay. Pregnancy with SLE. I'm going to write little bit here. Okay. If pregnancy with SLE, then we need to stop the steroids. We need to stop the steroids before first trimester. We need to stop steroids or treatment, but we can give after first trimester. Low weight heparin, low molecular weight heparin, and aspirin also. Why we need to give aspirin, heparin? Because it causes sometimes in fatal risk for neonates also, neonatal. And here we see the antibodies, antiphospholipid antibody syndrome. Antiphospholipid syndrome here. Okay, my dear friends. So in neonates, it causes the complete heart block. Most common presentation for neonates is complete heart block. So how we prevent this situation? We can use pacemaker and avoid NSIDs. In such situation, avoid NSIDs. So my dear friends, I hope you understand my lecture very well, and I hope this will help you to solve the questions. Now so many things to explain about SLE, but I decide to explain this one because from this they are asking so many questions. Okay, let's start our discussion with questions. Now, first question I am going to, in DNB November 2013 question. Yes. Antibody responsible for photosensitivity in SLE is, the question is that for antibody for SLE, we already know in photosensitivity, responsible is anti-Rho and anti-La. In pregnancy also we see anti-Rho and anti-La antibodies. Answer is this. Here options given: anti-Smith. Anti-Smith antibodies is the most specific antibodies. Anti-histone antibody is responsible, we already know, drug-induced. Okay, so here remaining another one option is anti-Rho. So anti-Rho is the answer, my dear friends. Okay, another question in DNB August 2013 pattern. Okay, now here the question they ask directly: a specific antibody for SLE is, most specific antibody for SLE. So I'm going to explain firstly the option: anti-Smith antibodies, anti-DS DNase antibodies, anti-histone antibodies, or anti-Rho antibodies. So my dear friends, as we know, rule out. So my question goes to Dr. Lal Singh. Please choose option B. Yes, he is absolutely right, but he explained B is answer. Yes, he is right, but I'm going to explain. If we, I already explained in my theory, anti-DS DNA is the most specific antibody, but anti-Smith antibodies is also specific. But if we think about anti-DS DNA, it is more specific. But anti-histone for drug-induced, I already explained. Anti-Rho responsible for photosensitivity. So my dear friends, I hope your doubts are clear. Okay, our next question. Karnataka 2010. The most specific antibody associated with lupus erythematosus is, most specific antibody associated with, I already explained, is dsDNA. Repeated question again, same. Okay, no problem. In AIMS 2010, one question: all of the following can cause SLE-like syndrome except drugs. So my dear friends, remember sheep, remember. Okay, here option is isoniazid, penicillin, hydralazine, sulfonamide. So my question goes to Dr. Jackie. Please answer.
A.
No, this time Dr. Jackie is wrong. I already told isoniazid sheep. As for sulfonamide, option right. H for hydralazine given. I for isoniazid and P for procainamide, not penicillin. So here answer is penicillin because except they asking. Okay. Then indication for use of cyclophosphamide in SLE is, in SLE we are going to use cyclophosphamide when diffuse proliferative glomerulonephritis. Okay. Another question, anti-dsDNA antibodies is specific for? It's very easy question. As we know, their option are given. It's a PGI May 2010. Very easy question. SLE systemic sclerosis. We already rule out it's SLE. No need to think about any options here. Then next question. 30-year-old lady present with Miller rash, photosensitivity, positive anti-nuclear antibodies. A lady, I already explained, 9:1 is ratio. A lady with photosensitivity, one. Another, anti-nuclear antibodies, Miller rash, butterfly rash, 24-hour proteinuria and 4 gram and pedal edema also. Likely the renal pathology will be. So we are going to know what kind of renal pathology. So diffuse proliferative glomerulonephritis. I already explained in renal because this is a case of SLE. This one is a case of SLE. Okay. Then another question they ask. Antibodies most specific for drug-induced lupus are. Option given here: anti-dsDNA, anti-Smith, ANAs, anti-Stone. So my question goes to Dr. MLA. Please answer.
B.
Yes, he is absolutely right. He is absolutely right because it's a very easy question. And anti-histone. Again, my question. Okay. Then the active lupus nephritis. Which one of the following prostaglandin excretion is increased in the urine? Options are prostaglandin E, prostaglandin L, prostaglandin A, or none. My question goes to Dr. Jackie. Answer.
A.
He is absolutely wrong. Answer is B, prostaglandin L. Okay. Anti-nuclear antibodies are present in what percentage case of SLE in UPSC 2007 question? Options are, firstly, again listen properly. Anti-nuclear antibodies present at what percent case of SLE? It's 50%, 70%, 80%, and the option is 90%. My question goes to Madan Lal. Answer please.
B. D.
Yeah, more than 90. B is not answer. It's very good. Most common manifestation of cardiac lupus is, I already explained. It's pericarditis. So repeatedly they are asking such questions, my dear friends. So I hope my theory will help you and you can easily solve the task without any problem. Again, only last question for today's session. That 23-year-old woman has experienced episode to myalgia. She is myalgia. If we think about the musculoskeletal system, it's myalgia. And this question in Delhi PG, Feb 2009. Pleural effusion, pleuritis, pericarditis, arthralgias without joint deformity over course of several years. Laboratory screening test to diagnose her disease would be, we know, firstly we are going for ANA, anti-nuclear antibody. No need to check the options also. So my dear friends, that's all. I already explained you so many questions and my reference from Harrison book, and after that we are able to solve any question, any. This is very easy task, and I am thankful for those who are watching my video, and I am thankful for Dr. Jackie, Dr. Lal Singh, Dr. MLA, Dr. Madan, they are actively participating in my videos. So if you like my video, please subscribe my video, and I'm going to be very glad. If you have any questions, you can put comments on it and I will try to answer you. So my dear friends, if you have any comments and suggestion how should I improve my videos, I try my best. If you have any comments, please write a comment, and have a good day. Thank you. Good night, my dear friends. Okay, goodbye. Thanks.